And I now call Peter Burke from South East Oxfordshire, who's going to be speaking for lines 76 to 84 and for the motion as a whole.
Conference. This country is facing three major problems. First of all, COVID, secondly, Brexit, and thirdly, the fact that it is saddled with a government which has no interest or ability to conquer either of those problems. We've been hearing earlier on, I think Munira covered it very well, about the kind of problems that we're facing. And this motion in its entirety covers a vast amount of the concern that we're experiencing about COVID. I'd like to support especially lines 76 to 84 referring to long COVID, and I'd also like to support both amendments, which I think are very good. Our last speaker made it very clear what kind of mixed messages are being sent out, how the public are suffering from hearing one day one thing, another day another. The government claims to be following the science, although that claim is being heard less often than it used to be. I think part of the problem is a lack of risk literacy among politicians. They talk about a case fatality rate of 1%, which I think many people find reassuring. They think you get COVID, 99% chance you recover. But as we've heard earlier on from Munira, and indeed from the very moving testimony to Leila's excellent APPG, it's not as simple as that. A lot of people suffer long-term disability. We don't know at the moment how long it's going to be. Many people may be saddled with problems for the rest of their lives and be requiring continued health and social care for that. It's not good enough to use empty rhetoric or promise grandiose actions in 6 months or sometime, whether it's called Operation Moonshot or not. And Boris Johnson promising to put his arms around people, schools and care homes sounds like pure gesture politics. I'm not sure how we can greet that with anything other than horror. Yes, we're doing more tests, but there's a false emphasis on quantity rather than quality, because what we have to do with tests is actually to use them in order to inform action, and that's not happening. Blaming the public, even where the majority of people behave responsibly, isn't good enough either. This pattern of blame shifting is one we've seen before. We've seen it in regard to Brexit as we do in regard to the pandemic. When the app failed, the government chose to blame Apple. Apple could have told you 6 months earlier this wasn't going to work. And yet the lack of competence by this government continues to be mind-blowing and has caused error and problem after problem. We're now facing a rate of increase equivalent to that in early April, but without the public confidence or financial means to make another lockdown possible. What's more, the second wave we're facing will coincide with the flu epidemic and with exit from the transition period. A perfect storm. I can speak about this with feeling as a GP. Tragically, the people who are going to die in the next month are probably already infected. And what we have to do is to prevent an already impending catastrophe from turning into something even worse. No amount of rhetoric will solve that. Oppositions have a responsibility to hold governments to account. Labour, despite its transformation under Keir Starmer, is verging on being Johnson's enabler. We, as the Liberal Democrats, must be the ones who can hold his feet to the fire. Support the motion, please. Thank you.
Thank you, Peter. Will Andrew George please stand by? And I now call